Lawrie Hooper, MHK for Ramsey, and of course, man in charge of the health. Looking now ahead to the next 12 months. And once again, if you haven't seen part one, we can't talk about certain things, but we will do a separate interview about that. What can we talk about this next year? I mean,
there's a lot coming up, if I'm honest. So you'll have already seen that we're talking about things like implementing our complaints sets of regulations across the health piece, actually completely overhauling the way complaints are dealt with, bringing in that more independent ombudsman to make sure there's that external perspective. You'll start seeing in the next couple of months the CQC reports coming out as well. So we've had the CQC over helping us inspect a range of health and care facilities and services, and actually as those reports start coming in, which we're now going to start seeing, I think from kind of October, November time, we're going to start publishing those reports as well, so there'll be a clear transparent kind of approach. So look, this is what the CQC is finding, alongside then actually how we're going to support Manx Care in trying to resolve any issues or difficulties that the CQC have identified. So that's kind of the next big thing that's going to start coming out of us. I think that I can completely be talking about. There's other stuff coming forward, which will be coming forward in the very near future, which I think will be big ticket items. Can't talk about it yet because it hasn't quite got to the council approval stage.
Can you give a little, which area it might be?
So it's around waiting list initiatives, actually.
Okay, so you're going to have a blitz.
That's the intention. Yeah. So we're going through the council process at the moment, and provided everything is agreed, then I'll be bringing something to Tynwald in the near future. So I think there's lots of good news coming out of the department, and will be coming out over the next kind of 6 to 12 months.
I mean, you've had an overspend, right, haven't you? I mean, like everyone's had an overspend. How's it now dealt with these days?
So that's interesting. So Manx Care are forecasting an overspend, as is every department, I think, at the moment.
Your heating bills must be phenomenal, for starters. That's just
one
part
so Manx Care are interesting because they're the only department at the moment, or the only body at the moment, that have a formal cost improvement plan. So we're a bit ahead of the game on this, because Manx Care have already got plans in place as to how they're going to reduce their budget to try and come in on track. And so the hope is that we will get to the end of the year and there won't be.
It's not going to happen, is it? Really?
I don't know, if I'm honest. I think the opportunities are there. I think Manx Care are alive to the risks. I think the one challenge that we may need some extra support with is around the inflationary pressures, because obviously when we started the cost improvement work and we started planning...
And and your heating bills, I mean, the things I know as hospital must be phenomenal.
Yeah, there will definitely be some challenges there, but my understanding is that that's a cross-government problem, I think, and so that'll have to be dealt with as a cross-government
How much do you take? How much do you think it's going to be then? How much, is your wage... how much do you take out of government for running?
Oh, so the total health budget is about 300 million. So
300 million?
Yeah, so it's about a third of government spending.
And you think that would be it, though, besides the inflationary bit, though? You think that's going to do it?
I'd hope so. Like I say, like I told Tynwald when I brought the last supplementary vote through, my hope would be that's the last time we have to do that, to go back to Tynwald for extra money as a result of an overspend. And like I say, we're working hard with Manx Care to make sure that we do everything we can to try and come in on budget. I can't make promises, obviously, but that's definitely the intention.
There's this perception that there's so many managers and too many chiefs, not enough Indians. I hear from people at the hospital. You certainly will be hearing from people at the hospital about morale and just how they feel they're not loved, they're not cared for. Yet the doctors over here, the newer ones, the younger ones, are getting paid, I think, 10 grand more just to come here. They're getting free accommodation, but they're not going to stay. They're just working themselves into a situation where they can't wait almost to get out. And I'm not trying to put anyone in the frame there, but I hear these things, and I'm sure and that's just the morale issue, which has gone on forever.
I think workforce challenges are one of the biggest problems, actually, and partly it's because we don't have enough people. So the people you do have are being asked to work harder and longer, and that's, you can kind of do that for a little while, but you can't do it forever, and you can't make that the basis of a health service, asking people to work from goodwill, really. And so Manx Care have got some big plans in terms of actually how do we fill those vacancy gaps, how do we recruit more people in, how do we then keep people, how do we retain them as well, stop them from leaving. We're also talking about how do you expand the training that's on offer. I've had a number of meetings this week, funnily enough, about trying to talk about how we train more nurses, train more doctors, train more specialists, train more physiotherapists, everything across the board. So there's a lot of work going on to try and say, actually, how do we improve the offer on the island?
The thing is, you're not the only one in this situation, let's face it. Every health organisation everywhere, I think, is short on numbers, aren't they? So
yeah, that's true, and we've got the added complexity that the staff on Ireland that we're competing for, people going into the workforce, for example, if you've got a choice between, I could go into health or I could go into any gaming company or what have you, there's a lot of opportunities on the island.
And so, a lot more money.
Exactly, and so we're competing in that space where there is a lot of job opportunity for people, and it's hard, I think, trying to sell the health service when actually, like you say, sometimes you're looking at quite substantial amounts of money.
And we have this older population, which by its very nature is going going to put more pressure on the services.
Yeah, and that is definitely a challenge that we're facing, and the question, if you've seen the economic strategy, is about how to rebalance our population to say, actually, let's try and make sure we've got more younger working people to support the services that we need to provide for people that are already here, in essence. And then that brings in the challenge around housing. So the other thing that I do, with not with my ministerial hat on necessarily, but I sit on the housing board with Chris Thomas, and we're working on a lot of stuff that says, well, actually, how do you solve that housing problem? And this is something I'm quite keen to get across when I talk to people, because you'll see the 100,000 people number in the strategy, talking about bringing more people over. And the question that comes back then is, well, how do you provide enough schools and enough doctors and enough everything?
Infrastructure, in every sense of it.
But actually, the answer to that question is, well, we need more schools and doctors and nurses anyway for the current population. And so how you solve the problem for the new people you need to bring in is the same way you solve the problem for the people that are already here. It's the same problem.
When you see things like the dentist waiting list, I mean, how can you fix that?
Bring in more dentists. I mean, in a nutshell,
it's so simple that.
I know,
but
I wish
if it was that simple, everyone do it. No, but
But actually, taking dentistry as a really good example of this, the first step is to say, actually, what is the need out there? We know that there are 1,700 or so people waiting for an NHS dentist, but also there's definitely people out there who have an NHS dentist that maybe aren't getting enough treatment or the right kind of treatment. And so the first question is, what's the need? When you've identified that, you say, right, how do we meet that? What sort of funding do we need? What sort of recruitment do we need? Do we have enough dentists on the island? We just don't have enough money being put into the system. It could even be as straightforward as, actually, we need to contract the dentist to do more work. You know what I mean? And there may be some quite easy solutions to the problems that we're facing, but until we understand what the need is, you can't really do that change.
And I've got to say, we're recording this the week before the big announcement. I know on next week there's going to be potentially, you now know what the potential solutions for all this, well, not solutions if it's that simple, but what the Isle of Man's going to do about the situation in the world. With prices, right? So next week we got something which we can't talk about. Also, again, because I don't know myself. But are you hopeful? Then let's try that one. Are you hopeful that we've got a good plan?
Yeah. So I can talk about the process we've gone through so far. So obviously the Economic Strategy Board met, Council of Ministers then met following that, and we had a long discussion around what kind of measures we could put in place. We then went to Tynwald and had the same conversation with Tynwald members to get their input and some feedback. I think it's already been announced to be another council meeting next week, where actually that's where the decisions will get made, and then obviously the announcements will follow.
I think it's in my diary for a press briefing on Sunday next week. I don't want to say too much, but
yes, so I'm confident that we've got a broad plan, I think, and that what's coming out from kind of Treasury and the Chief Minister is, we need to support not just a core group of vulnerable people, but actually, these energy prices are going to hurt everybody. So let's find a way of supporting more than what you would normally support with your targeted measures. So I think we're in a good place.
With just a few minutes left, I mean, parking this for 1 second, what does Lawrie Hooper want to do elsewhere? Any ideas, any private members' bills, anything else? Or have you got even time for that?
There's a lot, actually. So going forward, I mean, the next step for me is I did bring a private members' bill through last time round, is getting that in force. Actually, getting that implemented.
Remind us?
Around landlords, long leasehold tenants, so people that own a flat, basically, and the ability to set up a management company and run the buildings yourselves as tenants. So that's progressing, so there'll be more work on that, I think, by the end of the year. I'm working with the Housing Board to make sure that that's factored into all the work they're doing. There's quite a lot of stuff, I think, that needs to happen around national insurance, around tax strategy. A lot of the stuff that's coming out of government is stuff that I'm quite keen to see anyway. So there's a lot of consultations out. One big one at the moment is around family rights, family leave, parental leave, maternity, paternity, adoption leave, that kind of stuff. It was a big ticket item for me when I was in Enterprise the last time around. I'm really glad to see them consulting on this now, so I'll be making my own submissions, and so will the Liberal Voting Party, around what we think needs to happen. So there's a lot of stuff, I think, coming out that isn't just in health that I'm quite involved in and trying to dedicate some time to.
What about making a more open and transparent government?
Yeah, so
again, you touched on the first one. This is your mission statement, isn't it?
There's actually a live consultation right now about what they call a code of practice on publication schemes, which basically means how can government publish more stuff? So can we publish meeting minutes, for example, or department agendas? What about council? What can council publish to give people a better understanding of what's going on in that room? So that's already live. So again, anyone out there who's interested in that idea around open data and open government, actually have a look at that consultation and feed some thoughts in.
Let's hope something, because obviously, it doesn't look good at the minute what's going on. But just to finish with, have you done out of 10?
I think every year you ask me that question.
Oh, was I said one?
And I think every year I tell you 10 out of 10, Paul.
Brilliant, okay. I don't know if you do every time. But
simply because I'm working as hard as I think I can. And so I think if I thought I was doing less, I'd have to work more. If that makes
but
sense.
this one might be different because you've always been just the van looking in.
Yeah.
Now I'm going to ask you how you think the Canon administration, which you are now very much part of, how do you think the government's done out of 10?
That's a slightly more difficult question, I think. I think we're doing well, if I'm honest. I think I'd probably give us 8 or 9. I think we're doing well, but mainly because we're starting to make progress on a lot of the big issues that actually just have been left untackled for such a long time. And I think what you've seen already from ALF and from the Council of Ministers is a number of quite bold announcements around things that maybe you wouldn't have seen in the past, and I'm expecting that trend to continue. And like I say, with some hopefully some big announcements coming out of health over the next couple of months, it really is, I think, now time to grasp the nettle on some of this stuff.